Now, a medicine shortage in Northwest is threatening lives. In August, a raid by health officials found unpaid invoices at the Mmabatho medical depot because about 50 suppliers weren't paid. Hospitals are now facing a medicine shortage. The provincial health department is forced to use its medicine reserves. Remember, the department has been put under administration since 2018. Let's get some reaction from the Treatment Action Campaign's Sibongile Chabalala. Thank you very much, Sibongile Chabalala, for joining us. Now, members of the campaign have been in and out of the Northwest province for several weeks now because of the medicine shortage there. What is the situation? What can you tell us you found on the ground and patients' accounts?
What we have found out there, the situation is not good at all. Patients are struggling because of these shortages that keep on coming up. What we have found out is that mostly the medication that is not available or that is in the stock out is the HIV medication, which are ARVs, TB medication, which we know that if you are not adhering to your treatment, especially TB, you are most likely to die. And also the epileptic medication, which is the mental health medication. So that situation is very bad. When we talk to patients, they are very frustrated. We've spoke to a few patients which had epilepsy because they've been not getting their medication. The other patient was telling us that since from January he was not getting his medication. Up to today, up to last week when we talked to him, he didn't get his medication, and then he had an episode of epilepsy because of that. And when we go on the ground, we found out that it seems like a musical chairs game, where the other medication, when it's there, the other medication is not there. We have found out that the TB medication, which is Refina, it was not available in stock for 7 weeks. So you can ask yourself to say, what happened to those patients? What will happen? Because we know that TB needs to be treated daily. A person has to take medication daily. And some of the medication that is not available is the TEE, which is dolutegravir, M2 and efavirenz, the first-line regimen, and the new treatment, which is TLD, dolutegravir, lamivudine, and dolutegravir, it's always not on stock. So as much as we are saying we are bringing back people to the system, we are trying to address the last 90 of the paper of our targets. Then it means we are failing because the system also fails us if there are no medication in stock.
Well, thank you very much, Sibongile Chabalala from the Treatment Action Campaign. They've been in and around the Northwest province with that medicine crisis. Now, nearly